November is National COPD Awareness Month, and even though chronic obstructive pulmonary disease rates have been steadily rising, general awareness of COPD remains low. In this video, we'll explore what COPD is, how to prevent it, and how to increase public awareness of the costs and health risks of COPD. COPD is a cluster of several diseases, including chronic bronchitis, emphysema, and asthma, that cause airflow blockage and breathing problems. It's a progressive disease, so once symptoms settle in, the condition usually worsens without medical intervention. According to the latest data available from the Lancet Medical Journal, in 2019, there were approximately 391.9 million reported cases of COPD worldwide. COPD retained its position as the third leading cause of death, with an estimated 3.3 million fatalities reported in the same year. It's noteworthy that nearly 90% of COPD-related deaths among individuals under the age of 70 occurred in low- and middle-income countries. In the United States alone, as of 2020, approximately 12.5 million individuals had received an official diagnosis of COPD. However, it's believed that an equal number of people may have impaired lung function suggestive of COPD, but might not even be aware of it. COPD is currently the sixth leading cause of death in the US and a leading cause of disability. It also disproportionately affects rural Americans and women. These statistics underscore the severity of COPD as a significant global health issue. This data shows that there is a critical need for increased educational resources, particularly in lower-income areas, to raise awareness about COPD, which could potentially help mitigate the rising rates of COPD in these areas. The consensus on the cause of COPD is active smoking or secondhand smoke inhalation. Secondhand smoke carries over 7,000 toxic chemicals, some of which are cancer-causing and can damage the lungs and spawn disease. So while active smokers are definitely at a higher risk for COPD, so are non-smokers who spend a lot of time around smokers, such as the children of smokers, waiters and waitresses, and casino workers. Another leading cause is exposure to harmful dust, fumes, and chemicals in the workplace. This risk is further compounded if you live in a high-pollution area or have a genetic risk of COPD. This list is not exhaustive, and there are more causes that can lead to COPD. One of the hallmark symptoms of COPD is shortness of breath, also known as dyspnea. It's normal for most people to feel out of breath after walking up a long flight of stairs. However, if you start feeling short of breath for no apparent reason and have not been exerting yourself, that could be a sign of underlying dyspnea. Other symptoms of COPD include wheezing, whistling sounds when you breathe, chest tightness, excessive mucus production, fatigue, blue lips or fingernails, unexplained weight loss, and swollen feet or ankles. If you experience any of these symptoms regularly, talk to your doctor and ask if you can be screened for COPD. If your doctor thinks you have COPD, they can order many tests, seen here, to reach a diagnosis. With the data from these tests, your doctor will be able to come to a definitive diagnosis and begin treatment. Treatment options include smoking cessation counseling, bronchodilators, inhaled steroids, oxygen therapy, pulmonary rehab, and, in rare cases, lung surgeries. Prevention is still the best way to manage COPD rates globally. Educating children from an early age is a great way to steer them away from smoking before they start the habit. There are various strategies for smoking cessation programs and policies that have positive effects on childhood smoking rates. It's also important to recognize the value of smoking cessation even with active smokers. While it is true that smoking history does play a role in the later incidence of COPD, smoking cessation can prevent things from getting worse in the future. If you or someone you know is still actively smoking but would like to stop, the American Lung Association has a great set of resources to help. November is COPD Awareness Month, and everyone plays a role in its overall success. Please visit our website for a list of resources you can share to educate yourself further and help spread the word. If you or someone you know has COPD or is at risk, become part of the COPD awareness team by sharing these resources whenever possible. When you breathe easier, we breathe easier.